Hello, this is Dr. Richard Fleming, and today is August 15th, 2020. Today, we're going to begin the process of unmasking COVID and what is known about it and what isn't known about it. There are currently more than 3,000 clinical trials underway, and only one that actually measures the treatment effect of drugs given to patients with COVID-19. The remainder of the studies are providing treatments to various degrees, usually missing opportunities, but addressing other opportunities that are available in the treatment of this virus, and drawing conclusions based upon whether the patients live or die. Unfortunately, the way they're being done, it's very hard to determine whether any of the treatments are having any significant effect. During the last couple of weeks, a lot of attention was given to hydroxychloroquine and azithromycin. And the proponents of these drugs tell you that the earlier you start these medications, the better the results will be. The problem for them is that they have no measured outcomes to show whether that's true or not. The people who've gotten better may have gotten better without the medications. They haven't demonstrated this. They haven't measured an actual treatment effect. You go in to see your doctor and he puts you on or he or she puts you on a blood pressure medicine. We measure the effect. Did the blood pressure change? You go on a cholesterol lowering drug. We measure the effect. Did the cholesterol get better? You put you on a heart drug. We do studies to determine if heart disease gets better. But yet, in the thing that has caught everybody's attention throughout the world during this pandemic, there is very little attention being paid to actually measuring whether what people are talking about is working or not. With over 3,000 studies, it's amazing that there's only one that actually is measuring the treatment effects. On the other end of the spectrum, they would now have you believe that we should ramp up the preparation for vaccinating the entire planet because that is going to allow us to safely go back out in society. You know, for Dr. Fauci and Birx and Redfield and Hahn and Adams, I would ask you to critically determine what your vaccine that you're in such a rush to develop is really going to do. For those of you who don't really understand how vaccines work, let me take a moment to explain. You're injected, usually, although nasal sprays and other approaches are used, but in this case, you're going to be injected with something that is part of the virus. It's going to be injected into you in an effort to gear up your immune system to respond and to develop antibodies. For those who think there haven't been animal models on this, there have been. There's at least 2 major papers I've read and quite probably more that I haven't. It's not a matter of whether you can do this in an animal or not. The question is, does it benefit human beings to develop a vaccine and use it for COVID-19? Once injected with this part of the virus that they want to get you to build an antibody to, you're going to have an opportunity to develop those antibodies and hopefully have them around for a while. The data now shows that a while means probably 2 to 3 months, and so more than one vaccination is going to be needed. Attention is now being paid to the earlier part of the immune system, before the antibodies, our initial innate T-cell cytotoxic response, and that appears to be what there may be a benefit for the vaccines for. Here's the problem. The function of a vaccine is to prepare your body to be exposed to the real thing. So nothing about this vaccine even remotely suggests that we're going to get rid of this virus. You're going to get exposed to it naturally, and the idea is to shorten the amount of time that you're ill by a few days. But the acute T-cell cytotoxic response kicks in about 4 to 5 days in people, sometimes a little sooner, sometimes a little later. So if what you're trying to save is 3 to 4 days, typically the idea behind a vaccine, you're not going to save it when we're talking about the T-cell cytotoxic response, because the healthy people will already start to kick in their immune response in 3 to 4 days. Here's the real problem. The people that we're supposedly most interested in, those with the comorbidities who've been dying from the inflammation and the clotting associated from an immune response to the virus. If we vaccinate those individuals too, we're simply going to precipitate the same immunologic response that causes the inflammation and blood clotting in these individuals before they ever get exposed to the virus. We're going to precipitate the very thing that has been leading to their deaths. With over 3,000 trials, you'd think by now we'd have a better idea what actually works. We don't, because vested interests have led to this being a political fight and debate between politicians and federal agencies and who's spending the money and what's Congress doing and what does the WHO say, and maybe we should be following the CDC's approach. In the absence of actually measuring these treatment effects, this is nothing more than the blind leading the blind. And following these individuals or the politicians and the media and everybody whose attention has been focused on COVID-19 for the last 8 months. The method of medicine is to use medications and treatments when they're indicated for the people they're indicated for, and then to measure the response of that treatment to determine if it's the correct treatment or it needs to be changed. With over 3,000 clinical trials and trillions of US dollars, not to mention what's going on in the rest of the world, being spent to address COVID-19, is it really too much to ask for the federal government, for our agencies, which everybody claims are the leaders of the world and doing so much to help with COVID-19? Is it really too much to ask for these agencies to take a scientific, medically objective approach to the investment of our money and our lives, given all the hundreds of thousands of people that have died? If you have lots of money and you want to invest it, as the Gates Foundation does, I think that's great. But I don't think you have a place in this discussion of science and medicine when you're neither a scientist nor a physician. For the scientists and physicians that are out there, if you don't actually do any of the work in this field, I can appreciate that you want to have your opinions heard. But I think you need to be carefully weighing the words that you choose when the media is pouncing on just about everything being said. Unmasking COVID means being honest about what we do and don't know, and more importantly, paying attention to a scientific method of measuring the outcomes so that by the time the elections roll around, maybe we can have people being treated appropriately for COVID-19 and not continuing to die.